In a poverty-stricken mountainous area of Guizhou province, China, a group of children got up at 5 o'clock in the morning and climbed the mountain to go to the school. Eventually, they arrived at school with less than 10 teachers at 8 o'clock and thus began studying the most basic examination subject. Isn't such an education unimaginable? In a few words, it can be described as poor, scarce, and depriving. In such an educational environment, according to the report of Chinese Center for Disease Control and Prevention, this group of students from mountainous area in Guizhou lack trace nutrients in their body and at the same time the control rate of the chronic diseases such as hypertension and diabetes is extremely low. What is even more acceptable is that these children cannot afford the medical insurance and even sudden diseases are hard to be treated immediately. As a member of the city education, when I hear some news report, my heart is filled with concern. In our compulsory biology class, the teacher will populate information and symptoms of genetic diseases, chronic diseases, and contagious diseases to us, and teach us how to deal with illness correctly. When infectious diseases start to spread, we know how to carry out basic prevention and control. When people around us feel ill, we have the promises to know which medicine to buy to relieve the symptoms. Even when we go to the hospital for medical treatment, we can afford the medical expenses, and the medical insurance we once had can also relieve our financial burden. But what about those who have never received this kind of education we have? Due to the unfairness of the education, they have never been taught how to protect themselves in the field of health and have no idea what the underlying diseases are. It is precisely for this reason that they have lost the red line of the health protection for their body and repeatedly jump into the danger zone of the health. Not only that, the inequity in education has restricted the income of this group of people, so they are unable to afford the cost of medical insurance and can only rely on their own bodies to make ends meet. So, a circular chain emerged here. Poor education leads to poor health, and poor health in turn restrict the educational opportunities. So when we want to address the public health inequities, we must take measures simultaneously from both the education and health ends in order to break the vicious cycle of the educational inequity and public health inequity. So what can we or the government do? First of all, as people with abundant knowledge, we should acknowledge the places where educational resources are not so good. Perhaps incorporating knowledge beyond the basic courses into the volunteer teaching activity and popularizing health education at the same time can help this group of students shape the most fundamental values regarding nutrition, hygiene, and disease prevention and control. Just like building bridges, volunteering teaching activity, I participate in this summer vacation. And of courses, teachers would teach sex education, nutrition education, and mental health courses. It is precisely such educational organization that, while improving the educational resources, plant the awareness of health in the heart of those children. And at the same time, the government should touch the importance to the severity of the problem of educational inequity. The government could increase the investment in teacher and facilities in areas with poor educational resources, creating the possibility for exploration in this region. That is to say, this measure can serve as an outlet to break the cycle, enabling students to have the better employment opportunity with the improvement of their education, and thus have the ability to undertake more stable health security. Ultimately, educational inequality will always act as a major force to magnify the health inequality. To achieve the equity in public health, both we and the government need to rein in both ends of the vicious cycle so that the negative cycle can be inversely turned into the positive progress. Therefore, in order to build a fair world, we should safeguard the basic human rights of those students regarding education and health. We must not let those children who lost high quality education due to the unpredictable factor lose health choices.